Hi, you're welcome to Akweya TV. The issue of COVID-19 and vaccine availability has been a big one for the country. We have had situations where there is vaccine hesitancy. People have been worried about whether they should take the vaccine on the one hand, and then those who want to take the vaccines don't really have access. But something big happened recently, and I want you to just watch this clip, just a short clip from the National Primary Healthcare Development Agency.
Distinguished ladies and gentlemen, it gives me great pleasure to be part of this epoch-making flag off of the COVID-19 vaccination at Community Pharmacies. And it is important that we're having this event not in our offices, but in front of a typical community pharmacy. So I thank you very much for your leadership. I want to recognize the strong leadership and commitment of the Pharmaceutical Society of Nigeria and the Association of the Community Pharmacists of Nigeria for their relentless effort to ensure that this collaboration becomes a reality. Indeed, this collaboration is a step in the right direction, as it is in furtherance of our determination to expand access to COVID-19 vaccination and other immunizations services across the country.
That is the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, launching the COVID-19 vaccination in community pharmacies in Nigeria. And it's a big event, it's a momentous one for Nigeria, because administering vaccines in community pharmacies hasn't been the practice. There's been a lot of advocacy around that, and we really commend Dr. Faisal Shuaib for taking that step, along with all the stakeholders in the Ministry of Health. But here we have the pharmacists, the Association of Community Practice Pharmacists, or Community Pharmacists of Nigeria. In the studio, we have the National Vice Chairman. Yes, that's Mrs. Bridget Otote. You're welcome, ma.
Thank you.
Yes. And then we have the National Publicity Secretary, Mr. Kenneth Ede Ujah. Yes. Yes, you're welcome. Yes. And really, it's a victory on all fronts, not just for pharmacy and the health sector as a whole, because they are beginning to work together, but it's also a victory for Nigerians. So congratulations, ma.
Thank you, sir.
Congratulations. Yes. How do you feel about this?
I think you captioned it when you say it's a victory for Nigeria, for all Nigerians. It was a moment of victory for all community pharmacists, in short, not just Nigerians. It was a moment of excitement for all of us. It was a moment of, I don't know, you know how those days when we were kids, maybe you came first from school and you come home and your parents hug you and you feel on top of the world. You look at your brothers and sisters feeling so high.
Yes.
I think that was how we all felt.
Yeah.
There is no single word to describe what this launch means to us, means to Nigerians, means to our clients.
Yes. Yeah.
It is a thing of joy, and we give God all the glory. We thank Dr. Faisal Shuaib for making it possible in our own time.
Yes. Interesting. Pharmacist Kenneth, why was this taking so long when there was no law stopping administration of this in community pharmacies?
Okay, well, when I say it takes too long, well, the truth of the matter is that it has to work according to policy, and as such, the National Primary Care Development Agency has been shadowed with that particular responsibility to ensure vaccination and immunization among the communities.
Yeah.
So it's a matter of choices of government and prioritizing the health of the people. I feel that even though there are no any legal statement to say, okay, this is how vaccination should be administered or who should administer vaccination, we already know that it's actually represented with National Primary Care Development Agency. And we believe that at appropriate time, government policy will definitely change because the health of the people must be at the top of agenda.
Yes.
So we believe that whatever time, whenever time comes, it's actually the appropriate time.
Yes.
So, and it has been long coming.
Yeah.
The issue of vaccination in community pharmacies is the thing that has been in the pipeline for a very long time now.
Yes.
Successful government came to materialization at this particular launch.
Okay. Pharmacist Otote, what was the issue? What are the issues with administering vaccines in community pharmacies? Is there really a problem? Why wasn't it happening before now?
Well, it wasn't as if there was a problem. Much as it was not happening, there was no law that prevented that from happening.
Okay.
It was like a silent kind of agreement. I don't know if to call it that. So nothing stopped it from happening, and nothing also backed it up.
Okay.
However, the pharmacists are very well trained.
Yes.
Very well trained and capable to administer the vaccination. And trainings are still ongoing.
Okay.
We are continuously being trained.
Yes.
And I would call what is happening now a child of necessity.
Okay.
The COVID pandemic was like a war. You know, in war times, a lot of things come into play.
Yeah.
And in war times too, a lot of powers you had but never put to use.
Yes.
You decide to bring them on board.
Yes.
That's the only way I can describe this.
Okay.
Because there was an emergency. Here you have a group of very well trained personnel who were not being put to use.
Yes.
So it got to a situation where we had to look outside and see what those in other countries were doing.
Yeah.
And we saw that they were putting their pharmacies to use.
Yeah.
A lot of countries started way before our country. And we also decided to toe the same line. And thank God it has happened in our country. And it's a kind of forerunner to so many things to happen.
Yeah.
We are hoping that the COVID vaccination that has been launched in community pharmacies, we also bet even routine vaccination.
Yes.
We are still on the drawing table looking at the possibility, but we have to start from somewhere. We are starting with the COVID vaccination, and give or take, if it is handled properly, which I believe, I trust my people will handle it properly, I'm sure we are going to escalate it to even the routine vaccination.
Thank you. How would that be? I have been a bit worried since the launch that, storage of vaccines. Vaccines need optimal temperatures in terms of refrigeration. And then you have scarcity of petrol, you have difficulty with getting electricity. How are you going to get around this, especially with COVID vaccines? Okay.
I would first want to state that it is not every community pharmacy who is accredited to vaccinate.
Okay.
Because there are inspections being organized to certify that this community pharmacy is ready and prepared and trained and have all the facility to take care of the vaccines properly and administer properly. Facility in terms of equipment and personnel.
Yes.
And the pharmacists themselves are also being trained as vaccinators. We have our conference in a couple of weeks, and there's going to be another training for more pharmacists to become vaccinators.
Okay.
So, about the cold chain, we're in partnership with government, like you know. So most of us, apart from the fact that some of us have what it takes to maintain this cold chain that is needed by the vaccines, because it's part of even the requirement. We have thermolabile products, even that are not vaccines, that also need the cold chain storage.
What is thermolabile?
They are products that need to be kept within a certain temperature to maintain its efficacy. So we do that, and it's part of what is assessed in our premises before it is registered as a community pharmacy to a certain degree. Now, to a higher degree with the vaccines, But because we're in partnership with the government agencies, they have their cold rooms.
Okay.
And mapping has been done where, depending on the area of practice,
Yes.
community pharmacies are put under the closest primary health care center to them,
Okay.
where they have the cold storage
Okay.
to pick the vaccines.
Okay.
The vaccines, when open, can stay for a period of 6 hours.
Okay.
So we have gone ahead to also assist ourselves and assist our clients by picking specific days for vaccination,
Okay.
because the products are available right now.
Okay.
I think the lowest dose, they are all multi dose vials that we have, and the lowest dose is six doses in a vial.
Okay.
So to avoid waste, because we're also part of what we're also trying to avoid is to avoid waste.
Okay.
So to avoid waste, we have given our clients opportunities to book.
Okay.
We have chosen days of vaccination. Like in my place, it is Monday and Tuesday.
Okay.
However, we still go
Monday and
outside the Monday and Tuesday, depending on convenience to majority of our clients.
Okay.
And sometimes depending on convenience to me or to the pharmacist in charge.
Okay.
So we still go outside the Monday and Tuesday, but we try to pick specific days for vaccination so that clients book and come within the 6 hours.
Okay.
So that we keep the vaccine. Once we open them, we keep them active within those 6 hours, because after 6 hours of opening, it expires.
Okay.
It becomes inactive. It loses potency.
Okay.
So we are in partnership with the government agencies who keep the vaccines in stock for us. We go there to pick.
Okay.
And we open and make sure it is administered within 6 hours.
Okay.
So the temperature is not a problem for now.
Okay.
Once we are able to keep within the routine we have chosen, it is something that almost even those in the rural areas can even administer.
Yes, made by way of.
Is this free or should people pay?
Especially for now, the Association of Community Pharmacists of Nigeria has made it free for the public, at least for the next 3 months.
Okay.
Just to add to what my national vice chairman has just said, the cold chain is usually within 2 to +8 degrees Celsius. A lot of pharmacies actually have those conditions readily available. As well, and then 2, the association also is making arrangements for a kind of a cold chain product that will be supplied to community pharmacies, especially those that are actually in the interior of the interiors.
Yeah.
So that at any point in time, assuming the primary care center is far away from your location, and you really want to assist the community by giving vaccination, the Community Pharmacists Association is actually organizing a cold chain method, just the way it is, done in the national primary care centers.
Okay.
We're also making preparations for that.
All right.
Members.
And just to add that this has also drawn the attention of some international partners who are prepared to work with us. I know there is a suggestion for solar-powered generator. Okay,
I'll come to that just after the break. It's for those of you watching, this is, the amazing thing that Nigeria is pioneering. I mean, pioneering as far as Nigeria is concerned. The first time community pharmacists are administering vaccines, starting with COVID-19 vaccines. The conversation is interesting because we have the national vice chairman of the Association of Community Pharmacists here and the national publicity secretary. But just as we come back from the break, I'm going to ask them why the challenges we're going to be having with the rural areas, because we have just about 12,000 or less than 20,000 pharmacists in practice, right? How do they deal with the rural areas and the issues of the menace of fake practitioners? We'll be right back. Please share this video if you are watching on YouTube. If you are watching on NTA Makurdi, hop on the internet, www.youtube.com/AkweyaTV, and do subscribe and share the video.
At Akweya TV, we serve you with premium content on arts, culture, education, development, politics, entertainment, and lots more. Whichever perspective of our social lives as people may interest you, Akweya TV has got you covered. You can view our programs daily on our social media handles at Akweya TV, and don't forget on our YouTube that you will subscribe to our YouTube channel below. Thank you.
Welcome back, and thank you those of you who shared the videos. I can see you. We're really grateful. So back to this conversation before we go. Like talk again back to Pharmacist Ujah. There doesn't seem to be enough pharmacists for practice in the rural areas, you know, and we have about 220 million Nigerians with destructions everywhere, violence everywhere. Access is not even easy. What is the Acpn going to do about ensuring that this vaccination also happens in the rural areas, which is one of the places that really the need is really there?
Yes, thank you for that question. At the Association of Community Pharmacists of Nigeria, the leadership has taken a very close look into that particular issue and come to a conclusion of getting things in place that will encourage members and even the young graduates to go into those communities. As we stand, we have about 774 local government in Nigeria and some other development secretariats. So the national chairman, the president of Pharmacies, Adewale Oladigbolu, fellow of Pharmacists of Nigeria, has in fact is one of the mandates that he came into office with, that he wants to ensure that community pharmacists, young ones, young graduates, are able to go into this area, and there are good incentives to motivate whoever that wants to go to these communities, as well as like what my national vice chairman just said. Plans are in place to arrange solar panels, both the generators, the refrigerators, and the carrier bags for vaccines and some other labor products, so that when you get to these communities, these things will be available for your use. It will be available for you to maintain the integrity of these vaccines and some other labors for the purpose of benefiting the communities, the community dwellers. So I think the Acpn is fully loaded and is fully ready to do that at that level. Thank you.
And I would like to add to my national publicity secretary. The Acpn is not working alone. The PCN, being a regulatory body, is also working on the satellite pharmacy concept that will afford more pharmacies, registered pharmacies, to open satellite pharmacies in rural areas. I think when that is signed into bill, we will see the presence of registered pharmacies in most of these areas we are talking about. And I want to take us back to your talking about payment or no payment.
Yeah.
The government actually approved a ceiling of 3.5 for the COVID-19 vaccination, which is not payment for the vaccines but for service charge that community pharmacies are supposed to collect from clients. But the leadership of Acpn thought it wise that we should, that's when I say we, I mean community pharmacies should administer the vaccines free for the next 3 months as part of our corporate social responsibility to our society and part of our support to the primary health of Nigerians, because we want it to reach everybody. We want it to reach everybody, and it is also a known fact that community pharmacies are one of the most trusted by patients. We are one of the first centers they call on when they are ill and all that. We are close to them because we are very accessible to them. So we have decided as a body to help the government to achieve the target of immunization for all. So because of that, we are giving it entirely free for the next 3 months. And as a body also, we are assisting our members, just like the National Publicity Secretary mentioned, that we have put up various incentives and ways to assist members who might need such help to be able to give out the vaccination free, so that we get to all Nigerians free for another 3 months. What will happen after that 3 months, only God knows. But we hope that we'll be able to sustain it somehow, because we are talking to partners who are willing to partner with us. And we are also working with the National Primary Healthcare Publicity Agency, who have been very wonderful. A national working group has been set up, so we are in touch with them, dotting the I's and crossing the T's to see going forward how this will benefit all Nigerians within the legal frame that is available.
Does this entirely help the pharmacy profession in terms of community practice? Because you're a business first, how do you survive if you're doing all of this for free?
I always find it amusing when emphasis is laid on the monetary aspect of community pharmacy. Yes, we are in business, but we are practitioners before we are businessmen.
Okay.
And our training does not allow us to put money first.
Okay.
I can speak for myself. I have given treatment to countless number of indigent patients I perceive cannot afford. I don't turn them away. I've given free, and I'm sure so many of my colleagues are doing that.
Yeah.
So our training we don't put money first.
Okay.
So by training, that is what we get from school. The patient comes first. Yes, we are business personnel, but at the end of the day, we're also human. At the end of the day, the health of Nigerians mean a lot to us. And we do believe that with this vaccination thing, apart from collecting money for fee for service for the vaccination, it will also increase the inflow to our outlet. It will also increase the confidence by our patients. So business is not all about give with one hand and collect with another.
Yeah.
There are so many benefits attached to even giving free service. On our own, we do health outreaches. We give out drugs for free. We give out health talks for free. We do BP check and so many others. We don't collect money. But we know that at the end of the day, it comes back somehow. So it's more like whatever you do, you sit sowing.
Okay.
It's not all the time you give with your left hand and collect with your right hand.
No.
But it's going to affect our business positively. That we are sure of in the long run.
So I really want to thank the Acpn for all you're doing and for coming to the studio. Is there any other thing people need to know before we round up?
I want to tell the public that the Association of Community Pharmacists of Nigeria is holding our 41st annual National Scientific Conference. In this particular conference, there will be a training for vaccination as new vaccinators from community pharmacists, so that the number will keep increasing. Remember, we said the launch was about accredited pharmacies. By the time you have new vaccinators, getting it accredited will be more easier. So they should look out and watch out in their community. More pharmacists will key up and enter the frame of vaccinators and vaccination centers as time goes on. Thank you so much.
Accredited pharmacists do we have now?
In Abuja, it's 30, about 30. Yes, I can be specific with FCT.
Okay.
But there are so many in other states too. And the accreditation is ongoing.
Okay.
So the inspections are ongoing, and the inspections are being done, more are being accredited. So it's ongoing. It's something that just started. But in the FCT, there are about 3. And every local government, 3, about 30.
30.
So every local government within the FCT has somebody at least. Then now they want to add to what my publicity secretary has just said, the National Publicity Secretary, that we have noticed a trend that most Nigerians think there's no more COVID vaccine. I want Nigerians to know that we still live with the COVID pandemic. Maybe so much noise is not being made about it, but people are still dying every day due to the COVID infection. We are now talking about is it monkeypox and all that. So there are so many infections that were not known to us before that are coming on board. So there is need for all Nigerians to be very health conscious. And I do not think that maintaining the COVID protocol is damaging or harmful to anybody. So it doesn't cost anything to maintain those protocols, just for your own benefit and for the benefit of people around you. So I encourage all Nigerians to get vaccinated and maintain the COVID protocol, whether the government is enforcing it or not. Your lives or our lives are in our hands. So let's make hay while the sun sets. Thank you.
Thank you so much.
Thank you very much. I know that as pharmacists, you say as men of honor, you join hands.
Yes, sir.
Now with COVID, as men of honor, what would we do?
We join elbows.
We join elbows. Okay. All right.
We are still joining hands. Sanitizers in our pockets.
Yeah.
Thank you so much. On that humorous note, I really want to thank you for keeping with us and thank our guests in the studio for being with us today. We look forward to hearing from you. If there are any complaints or issues, do put them in the comment section. We will try to get them across to the Acpn, and we know they are going to be resolved. Thank you so much and remain in touch.